Many patients ask me about angioplasty and not only in the heart. I'm Dr. BenMaamer, board certified surgeon, and today I wanted to explain this clearly so you can make informed decision. This is education, not personal medical advice. So let's start by explaining what it is. Angioplasty is a minimally invasive procedure used to open a narrowed or a blocked artery. Most people associate it with the heart, and yes, coronary angioplasty is very common. But angioplasty can also treat carotid artery going from to the neck to prevent stroke, renal artery, kidney blood flow, the iliac and femoral artery in the pelvis and in the leg, and peripheral artery in the distal leg. The principle is the same. So through a needle, we inject a small catheter. That catheter has at the end a balloon. Balloon is inserted through that blood vessels. So the balloon we inflate the balloon at the level of that narrowing area that the plaque compresses, blood flow improves. Sometimes it recoils, so we have to put a stent there, and that will keep the artery open. To understand why this matters, we need to look at what happens inside the body. Arteries narrow over time to what they call it atherosclerosis. Plaque build up made of cholesterol, calcium, and inflammatory cells. What are the triggers? High blood pressure, diabetes, smoking, high cholesterol, genetic predisposition. These injury that happens to the inner lining of the artery, and the plaque forms. So the body will attempt to repair. Fat and inflammatory cell accumulate. The vessel gradually stiffens and narrows. Blood flow reduces. When narrowing reaches 50 to 70%, symptoms may begin depending on location. If it's the heart, patient may develop chest pain. If it's in the brain, dizziness, mini stroke. If it's around the leg, pain when walking, we call it claudication. For the kidney, it may develop uncontrolled blood pressure. So acute event that may happen, plaque can rupture, a clot can form, and that will give you complete blockage. That's when emergency happens. For the heart attack, if it happens through the brain, it will give the patient a stroke. For the leg, it gives a limb-threatening ischemia. And this is where timing becomes important. Angioplasty is not done for every narrowing. So what are the red flags? Chest pain with exertions, sudden weakness or speech difficulty, leg pain after short walking distance, non-healing wounds in the feet, severe and controlled hypertension due to renal artery stenosis. So who are the group with risk? Diabetics, smokers, patient over 50, patient with prior vascular disease. Early evaluation changes outcome. That's paramount. And not every patient needs a stent, but every patient deserves proper assessment. I'd like to finish with the good news. In many cases, early action changes everything. So what you can do? Prevention first. control blood pressure, manage cholesterol, stop smoking, exercise regularly, control diabetes. So what question you should ask your doctor? Is this narrowing significant? Do I need imaging? Can medication work first? What are the risks of waiting? So when to monitor versus to treat. Some stenosis are observed with medication and lifestyle changes. Others require intervention because risk outweighs delay. So when you should ask for a second opinion. I think it's reasonable when symptoms persist, you feel uncertain, the recommendation is urgent but not emergent. You know, angioplasty is a powerful tool, but the real power is informed timing. If this helps you understand your health more clearly, follow for more physician-guided explanation. And if you believe healthcare in America needs to change, hit follow because we are building momentum one video at a